Welcome back. This video is about signs and symptoms of multiple sclerosis. Multiple sclerosis is a chronic, potentially disabling disease of the central nervous system, which include the brain and the spinal cord. It occurs when the body's immune system mistakenly attacks the protective covering of the nerve fibers, which is known as myelin. This process is called demyelination. The exact cause is unknown, but it is believed to be an autoimmune disorder. Genetics, infections, and environmental factors may play a role. In multiple sclerosis, damage to myelin slows down or blocks the messages between the brain and the rest of the body. The signs and symptoms of multiple sclerosis can vary widely depending on the location and severity of the lesion, and they can also vary significantly from person to person. First are the early signs. These include fatigue, extreme tiredness, often disproportionate to the level of activity. Next is sensory disturbances, numbness, tingling, or pins and needle sensation, often in the face, arms, legs, or fingers. Then vision problems, blurred or double vision, pain with eye movement due to optic neuritis or loss of vision in one eye. Next are balance and coordination issues. These include dizziness, loss of balance, clumsiness, frequent falls, or difficulty with fine motor skills. Then cognitive changes, problems with memory, concentration, or thinking clearly, muscle weakness or stiffness, weakness in the limbs or muscle spasm and tremors, bladder and bowel problems, difficulty controlling bladder or bowels, or change in bowel habits, mood changes, depression, anxiety, or other mood swings. Next is pain, neuropathic pain, muscle pain, or other pain related to nerve damage. Then speech problems. These include slurred speech, electric shock sensation, especially when moving the neck. This is known as Lhermitte sign. Now the later signs of multiple sclerosis. These include progressive weakness, worsening muscle weakness, making it difficult to walk or perform other activities, severe spasticity, increased muscle stiffness and spasm, potentially causing pain and restricting movements. Then severe cognitive decline, significant memory loss, difficulty with problem solving, and impaired executive function. Bladder and bowel dysfunction, more severe and persistent problems with bowel and bladder control. Next is swallowing problems, difficulty swallowing, potentially leading to aspiration and pneumonia. Fatigue and pain, these can worsen over time, becoming more debilitating. Now there are 4 types of multiple sclerosis. First is relapsing remitting multiple sclerosis, the most common type, with flare-ups followed by recovery. Second is secondary progressive multiple sclerosis. Symptoms worsen over time after an initial relapsing remitting phase. Third is primary progressive multiple sclerosis, steady worsening of the symptoms without clear relapses. And the fourth is progressive relapsing multiple sclerosis. This is rare with steady decline and occasional relapses. Now the diagnosis and treatment. Diagnosis is based on MRI scans, spinal fluid analysis, and clinical signs. Now there is no cure, but treatments like immunosuppressive drugs, physical therapy, and lifestyle changes help manage symptoms and slow progression. It is important to note that multiple sclerosis symptoms can fluctuate and vary in severity from person to person, and not everyone will experience all of these signs. I hope you liked the video. Thank you, and please subscribe for more informative health related videos.